Welcome to the channel, folks. This is Chuck from Homestead Medical. I was going to release another video this week, but I was watching a couple of videos, listening to them while I was working earlier today, and one was Grumpy Acres. He was talking about the coalition of homesteading and prepper community coming together, how they correlate, how they can kind of coexist, how they're very similar. And with that, forming a mag, being prepared. And then I was also listening to an interview on Max's Path channel, and I'll put the links to both those channels in the descriptions. He was interviewing Matt O'Neill from Prepared Patriot, North Carolina. And one of the things that they said is Matt was being interviewed saying the things he wanted to be more prepared for, to train more for, take more classes for is medical. Now, I've been doing healthcare in the medical field for coming on 29 years. And I've taught for 20 plus years. And things that I've found that most people want to skimp on when they're preparing and when they're spending money on is medical. Most people have an IFAC. This is special operations, compact tear-off. They're prepared for that because it looks cool. They got to have it on, you know, their war belt, their gun belt, whatever you want to call it, with all their other stuff and accessories, which is great. You should have it. If you carry a firearm, you're a prepared individual, you should have medical. But a lot of people don't want to carry it every day. A lot of people make the excuses of they don't want to carry things every day. And listen to Grumpy's thing he was talking about is about being prepared is, you know, everybody in the homesteading community, prepping community, things like that, you want to be prepared. You want to be well-rounded prepared. You're preparing for emergencies. You're preparing for whatever the case may be, whatever your main motivation is. But there's no excuse not to have medical. Yeah, some people say it's bulky. It's hard to carry every day. I carry this every single day, every day. Do I change my dress on it? Sure I do. I wear a lot of pants, has cargo pockets, things like that. They're not the big bulky cargo pockets or anything, but this is slim. I can stick this in my back pocket. I have everything in here: chest seals, pressure dressings, wound packing gauze, nasopharyngeal airway, a needle for chest decompression. Those are things that are going to kill you immediately, within minutes. You know, I always have a tourniquet on me. I'll always do. Every single day, here it is. It's in my pocket every single day. Anytime I leave, do anything, when I get dressed, it goes in my pocket. No matter what you're doing. If you're a homesteader, you're out, you know, you're working. Whether you're working with the animals, repairing a fence, using a chainsaw, cutting down a tree, doing whatever it is, do it. If you're somebody who enjoys the outdoors, you're going camping, whatever, you don't know what's going to happen, and you want to be prepared. So with that preparedness mindset, why wouldn't you take the training? All of this stuff is ridiculous to have if you don't know how to use it. That would be like going out and purchasing your first firearm, getting a holster, sticking it on your body, and then carrying it, thinking, all right, I'm ready. You're not. I don't care what anybody says. I don't care. You're not ready. Medical is, you know, I say it's not rocket science, and it's not. The medical community has, I think, fooled the general public to think it is some sort of rocket science, and it's not. It's skill, it's knowledge. There are some things that, yeah, you have to have great knowledge, many years of training for. And I'm not knocking anybody in the medical field. I've done it for 29 years. I've practiced being a medical practitioner for 29 years. And that's what it is. You're practicing because you're always learning. You're never an expert. Surgeons. Yeah, am I a neurosurgeon? No. Am I going to be able to fix a brain lesion or a bleed or something like that? No, I'm not. I don't possess those skills, but I can take care of somebody until I can get them there. But that's the problem. Are you ready for that? What if there is some sort of natural disaster, societal breakdown, economical collapse? You read the news, you see what's going on. I'll let you make your own judgments. I don't believe in the whole prepper porn thing of, the world's coming to an end, zombie apocalypse, whatever the hell you want to call it. You need to be ready. I believe in being ready. If you're a homesteader, you plant a garden, you have livestock, you work hard to take care of those things. You spend a lot of money, a lot of time, a lot of effort. Why would you not invest in being able to take care of yourself or your loved ones if something happened and you don't have immediate conventional medical care there to you? I did a short about medical intelligence. If you're going to, medical intelligence is just that. Research what you're doing. Where do you live? Have you ever seen, how far is it from a hospital? What are the capabilities of that hospital? Is it a level 1 trauma center? Is it a level 4 trauma center? There's a huge difference. What type of capabilities do they have? Is it a STEMI hospital? If you have a heart attack, can you get the proper treatment you get, or are they going to have to transport you to another hospital? Are you so far away from a hospital you need to call for aeromedical, because if there is a true emergency, you need to get there quickly? Have you thought about investing in some of the paid membership programs for these aeromedical services? Is your ambulance service, your local EMS service, fire department, however it's ran, is it staff full-time? Is it volunteer? What's your response time to where you're at? It all goes back to training and being prepared. And why wouldn't you train? We train for everything else. I trained today. We've got all the cool guy ninja stuff, the chest rigs, the fire. And I believe in that. Don't get me wrong. You should train it. Invest the time, invest the money into seeking good professional training from people who know what they're doing and can pass something of value to you. Can those people make something actionable for you? Can you gain value from it? All these things are things that nobody thinks of. Nobody wants to talk about, but medical always gets pushed to the side because you want to do the cool guy ninja shit. Great. I love the cool guy ninja shit. I believe in the cool guy ninja shit, but I also believe you need to be prepared medically. I have by default, any group I'm with or anything we do, I'm the medic in case something goes wrong because I carry stuff with me all the time. I have a bag in my vehicle. I actually have 2 bags in my vehicle. It's human nature. It's just something I've always done because you don't know what's going to happen. You don't know when you're going to be sick. You're going to be injured. Somebody around you is. Are you prepared for it? Can you recognize the signs and symptoms of a heart attack? Can you recognize the signs and symptoms of somebody having a stroke? Or can you just recognize the signs and symptoms of somebody being dehydrated? Because now as we get warmer, guess what? That's going to be more prevalent. You're outside. You're doing things. You're working on the homestead. Are you staying hydrated? Do you know the signs for yourself? Oh, I better drink some water. Or I better hydrate more. Or you see somebody. Can you differentiate between dehydration and a stroke? Some of the things are similar. Were you aware of that? All this comes down to training. Wound care. What are you going to do? What are you going to do if for some reason conventional medical care is a tornado, a hurricane, whatever comes through? Your closest hospital or the hospital in your region, it's not there anymore. It's not serviceable. So now you're an hour, 2 hours, whatever the case may be, from conventional medical care. Or what if because of this natural disaster, whatever the event that may be happening, EMS can't get to you. It's paramedic long time. I have been, still am a paramedic. I worked, for ambulance services, municipal services, 911. There were times in the municipal area I was in, we couldn't get to people. Weather related, ice storms, whatever the case may be, we may not be able to get to you. What are you going to do? Take the training. I hear it so often. Oh, I'd love to take a class, but I just don't. And I get it. Times are hard. The money isn't there. Things cost more. I know. I get it. I'm right there with you. But what's more important to you? Are you more likely to use the handgun that you bought that's got, the optic on it and the light on it, and you've put this on it, or this slide, or this new trigger, or all of that, and you're carrying it every day. Great, you should. I do too. Which one are you going to use first? Medical or that firearm? Watching that interview on Max's Path with Matt O'Neill from Prepared Patriot, North Carolina, it's what he said. It's exactly what he said. You're more likely to use medical than you will that firearm. You're going to need a doctor. You're going to get hurt. You're going to get injured. What's going to happen if whatever happens? Think about different places in the world right now. Things that are going on. They don't have conventional medical care. Think of what could happen. Have you been in a natural disaster? Were you in Hurricane Katrina? Were you in Matthew? Were you in one of the tornadoes that hit Kentucky or Mississippi or anywhere in the Midwest? Life was disrupted. Well, with life comes that medical care disrupted. So why can't you take that training? And I'm not saying, do I want you to take training from me? Yeah, of course I do. I'm not going to sit here and act like I don't want that money. I don't want to, but I'm passionate about it because what I'm teaching you, it's what a lot of people aren't, and what's being done. What happens after you stop the bleed? You put that tourniquet on. You put the pressure dressing on. All right, got him done. Used my IFAC. I've used all the stuff in the IFAC. Now what? All of this is designed because immediate care is coming. This is stuff that's in these IFACs. Your tourniquet, your chest seal, whether it's a needle decompression, a nasopharyngeal airway, a pressure dressing, all of these things are designed to stop an immediate threat. Just like you have, when you've got to stop an immediate threat that, God forbid, I hope you don't have to with your firearm, and you train and you take the classes and you go to tactical response, or you go to Prepared Patriot in North Carolina and you take their classes. That's to stop that threat immediately, right? Well, that's great. You've stopped the threat. You've stopped the threat of dying. You've put the tourniquet on. You've put the chest seal on. Now what? What are you going to do? How are you going to take care of these people? How are you going to provide the supportive care? That's not no cool guy ninja shit. What about that wound? You stop the bleed. Now what? You got to clean that wound. You got to flush that wound. You got to debride that wound. Do you close it? Do you leave it open? How do you know? That's what training's for. It's exactly what it's for. Can I teach you these things? Yeah, that's what I teach in my classes. I teach all of that. I will teach you debridement. I will teach you how to properly clean a wound. Look, evaluate that flesh, that skin, that muscle tissue that you see inside of that wound. Okay, that's dead, needs to come off. That's not, that's viable tissue. Now, okay, we're where we need to be. It looks good. It looks like this wound is cleaned. How much? How much fluid does it take? What type of fluid do you use to clean it? You can dump alcohol in there? You can. If that person's unconscious, they're going to become zero unconscious in just a second. And they're not going to like you. So it's knowing it, and I wouldn't use alcohol. Good chance you could hurt that flesh that's inside. Did you know that? You may not. Why wouldn't you know that? Knowledge. Do you know how to debride that wound? How to get it out? There's stuff in there, or there's tissue that is damaged beyond repairable in there, and we need to remove it so it doesn't become necrotic, and from there it gets infected, and that infection then turns systemic and septic in the body, and then runs through the body. You're now in septic shock. You now die. And that can happen in hours. So all of these things is what training's about, and why you need to do training. You can call this a rant video. You can call it what it wants. But I've had it here lately where people have canceled classes, or they want to have a class. Oh, well, you know the way money is and stuff like that. Now what do you do? How do you take care of it? What equipment do you need? And it's all that medical intelligence. I know it can be overwhelming when you're sitting there and you want to be more of the prepared nature. You're an adult. It's your responsibility, in my opinion. You're a grown-ass man. You should be prepared for whatever is coming at you. You shouldn't rely on the government. You shouldn't rely on anybody, your neighbors or anybody else, to take care of you. So why not be prepared? Why not invest in that training? Because you're going to use that medical. I promise you, you're going to use that medical before you'll ever use that firearm or any of the other defensive stuff that you take. Do you got to grow the food? Yeah. Do you have to store the water? Yeah. Do you have to have reliable water sources? Yeah. All of those things. Again, it can be overwhelming. Where do I go? Which way do I go? You're going to use medical. I promise you, the top 5 things, you're going to need it. You need to be prepared for it. I promise you, you have 1 or 2 people that have an open wound that you have to take care of for a couple months. You don't have enough gauze. You don't. That's what you're going to use the most of. I'll show you. Say, oh, but I need sterile water. I need this or I need that. No, you don't. No, you don't. I'll teach you how to do it. If you don't take the training from me, take training. But take beyond training. You go to tactical response, you take fighting pistol, you take advanced fighting pistol, you take fighting rifle, you take advanced fighting rifle, fighting shotgun, whatever. You go to any of these other trainers, Prepared Patriot, North Carolina, any of these people, you take it from Jerry Nuss, whoever, Dawn, I mean, all these people that are great trainers. But you take their more advanced skills, which you should. But you're going to use this medical stuff. And all of those trainers, guess what they're going to tell you? Take medical. Be prepared. I know you care about your family. You care about your group, your MAG, your mutual assistance group. You all want to be prepared. I bet you may, if you've got a MAG, I bet you've got a medic. If you don't, you better. Is that medic really prepared? Is it the best person you can have? Do they have all the tricks? Because if they tell you, oh no, I'm good, I'm squared away, I got it all done. No, they don't. Could be a nurse. What kind of nurse are they? They work in a doctor's office or do they work in an ER? And even working in an ER, let me explain something to you. I'm not knocking nurses, I'm not knocking doctors, I'm not knocking anybody. Look at their experience. Have they worked in an austere environment with limited stuff by themselves with real trauma patients? It's a big difference. I've worked in an ER. I've worked by myself in the back of an ambulance. It's a big difference when you've got a true traumatic patient, when you've got 6, 10 sets of hands helping you in an ER, and then when you're by yourself doing all those same things to a certain extent by yourself. Are they prepared for that pressure? Doctors, same thing. They're not used to working without support. So they should take training. We all should. You should continually take training. I've taken the same classes over and over and over from different instructors. And every single one, I've learned something new. And not just medical. God knows how many. I became an instructor in a lot of medical stuff, so I wouldn't have to keep taking the classes over and over and over. But I still learn. I still learn from all the different instructors. I learn every time I teach. And yes, I've taken multiple fighting pistol classes or defensive pistol classes and rifle classes from different people. Is it the same content? A lot of it is. A lot of it within the same context, but they all may have that one little nugget of information that nobody else said or taught you. It sticks with you. And that one little nugget could be a defining factor in whether you live or die. So stack your deck in your favor. Take a class and vet them. Ask questions. You want to take one? Ask questions. Yeah, my website explains the classes. Does it explain it in detail? No. Email me. I'll call you. You're not sure about a medical kit. You can buy them prepackaged, and there's a lot of good ones out there. Refuge Medical. Dean from Survival Tips and other stuff. Dean Dupree sells things, and it's great. There's a lot of people who sell stuff. You have prepackaged medical kits, but you should. But do you plan? Do they teach you things about that? They teach you medical stuff, but do they talk to you about how important this is? Communications? What are you going to do, or what do you think medical is going to become if your conventional medical care is not available? What if you do have a group that's set up? But what if that doctor, you may have an ER doctor, you may have an internal medicine physician. He can't get to you. What if you have these communications set up to where you could do telemeds? Oh, what's that? Well, I can explain it to you. But you have these. Have you taken training on these? Do you know how to work it out? I've used a radio for 30 plus years in emergency services. Whether it be fire department, whether it be EMS, whether it be working security that I did overseas and stuff, as a medic in different places. I'm not an expert in the radio, but you know what? I'm going to go take a class, 0 to Hero from Radio Made Easy, radiomadeeasy.com. Go talk to Evan, take a class from Evan. Get your radio from Evan. He'll set you up, the whole package. And then he'll train you on where you're not even sure where to turn this on to where you'll know how to use it. And that little bit of communication may get you the help you need, or maybe you could talk to somebody, hey, and you're talking to a doctor or whatever, somebody in Radio Link could set you up with something, and now I don't have a ham license, or I don't have that. In an emergency, all that shit's out the window. But maybe you need to call for help to get somebody from medical because you don't have that. And I hope, Evan and I have discussed it a little bit, I hope we do a collaboration where we're going to do a little class on how important communications and medical, how they tie together, and how important telemedicine will be. So take the training, seek that knowledge from somebody who has the experience and the skill to actually pass it on to you, so it's actionable material that you can then take it back to make effect on your life. There's so many different things I could sit here and babble on shit all day long, but I'm not going to. Take the class. Take a class from me. homesteadmedical.us. Chuck at homesteadmedical.us. Email me. Come and see me. Come talk to me. Take a class from me. If not, you think, no, I don't like him, he's an asshole. Fine, I get it. I am. At times, I can be. I'm opinionated. I get it. We all do it. I'll recommend somebody to go take a class from. Your med kits. Where do you go? What do you get? How do you do that? You should be prepared because you need to have that med kit. I can put a med kit together for you. Do a custom medical kit. Doesn't cost anything extra. You send me an email. I want a custom medical kit. I'm then going to call you, and then we're going to go back to that medical intelligence I was talking about. Where are you? What are you doing with it? What type of activities do you do? What is your threat level? All of those things. And then we're going to build for it. Who's in your family? How old are your kids? What are they? Because that's going to mean the difference of what equipment I put in here. This is not a tourniquet that fits all. But I've become a distributor for a device that is great on pediatrics. The Slishman Rant. Dr. Slishman did it. I spoke to him on the phone. That's why I want to become a distributor. He called me and we talked. Great guy. Very knowledgeable. I believe in the product. I'm going to sell it. I'm going to include it in my kits. Just like I include cat tourniquets or soft T tourniquets. By the way, Tactical Medical Solutions, I'm still trying to become one of your distributors. How about somebody let me? Since George is too busy on his little area to take on anybody else. God, I don't quite understand why business doesn't want to make more money, but hey, you do you. So, let's think about these things. Let's be prepared for these things, and let's do these things. Call me. I'm always available. I hope you stay safe. I hope you train. I hope you're prepared. I want you to be prepared. Prepare with confidence. Prepare with the training you need. It's not rocket science, folks. It's not. It's just skill and knowledge. I can pass it on to you. We can train together because that's the way I look at it. You may teach me something. I'm going to teach you some things. But we're all going to learn together. And I learn every time I do this, every time I teach. Reps, 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 reps. It's just like anything else. It's just like drawing your weapon. It's just like doing whatever. You get better with a tool. Every time you use your chainsaw, you learn something, all that. But when you use your chainsaw, do you have a tourniquet? Do you have a med kit on you? Do you? Are you prepared for that? So let's get prepared. Let's do it. Let's be smart about it. Let's be adults and make sure we're prepared for everything. The world isn't getting better. Healthcare sure as hell's not getting better. Just be prepared. I don't want to see somebody I know, I'm acquainted with anything. There's no reason for needless deaths of bleeding to death. Still one of the number one traumatic injuries, causes of death, can be stopped. It's a preventable cause of death. The number one preventable cause of death is bleeding. Bleeding out. There's no reason for it. Take the training so you're prepared. Make sure your kids are safe. Your wife is safe. Your spouse, whoever, your partner, whatever the cool, politically correct word of whatever you're seeing gender today is. Make sure you have people in your group. What about just when you pull up on a car wreck? How many car wrecks have you pulled up on? Could you make a difference? Could you have saved somebody's life? What's wrong with being a good person? What's wrong with trying to help? And having that equipment and being prepared. And then, I don't know, knowing how to use it. I can have all this cool guy shit you want. Am I an expert using this stuff, the firearms? Hell no. That's why I take training. That's why I go and practice. That's why I still take training in medical stuff. That's why I still practice. But I carry it, and I want to be confident in what I do. So prepare with confidence. With us, we'll prepare you with confidence. I want you to walk out of a class that you can go and do this stuff as soon as you learn. And we'll stay there as long as it takes. If you don't believe me, ask some prior class attendees. I'll put you in touch with them. I won't talk to them. I'll let them tell you the truth. But I want you to be prepared and I want you to be ready. So with that, prepare with confidence. It's in rocket science, folks. You can do it. I hope to see you soon. I hope we train together soon. And we'll be releasing more videos, more shorts, and we've got more news coming. So we're now a distributor, proud distributor of the Schlissman wrap, and we hope to get the traction splints going. What's traction splint? I don't know. Take my class. I'll teach you. So go out there, do it, train, do the things you need to do, be prepared. This world isn't getting any better, and I hope to see all of you soon.